Hi, I'm Morgan, and Devin and I worked on researching mood disorders.
Here we will be defining mood disorders. Mood disorders can be classified by any group of mental conditions characterized by persistent disturbance of mood. This is especially seen in the form of depression or euphoria, or a combination of them. This can also be called affective disorder.
There are two types of mood disorders. The first is depressive mood disorders, and the second is bipolar.
Experiencing a depressive disorder is much bigger than just experiencing a state of depression. Having a depressive disorder causes a persistently low or depressed mood and a loss of interest in things that you used to enjoy doing. To experience a depressive disorder, these low moods must last for at least 2 weeks for a proper diagnosis. People that suffer from depressive disorders have a very high suicide risk. At least 10 to 15% of people that experience depressive disorders report attempted suicide across their lifespan. 1/2 of all people with this disorder report at least one suicide attempt throughout their lifetime. This disorder is caused by environmental stressors, symptomatic illnesses, comorbidities, trait impulsivity, and interpersonal conflict. On this slide, we drew a visual of depressive disorders. Here you can see that this man is very excited to play with his toy. Once he experiences his depressive disorder, he's not happy anymore and doesn't want to play anymore. The symptoms of depressive disorders include low energy and quality of life, guilt and worthlessness, less sleeping and eating, suicidal thoughts, low ability to focus and function. Early diagnosis of depressive disorders is very challenging. Depressive disorders are, in fact, hereditary. Here we will be talking about our treatments for depressive disorders. Most participate in psychotherapy, which can be cognitive and interpersonal. Interpersonal therapy can consist of seeing a therapist at least one time a week. Many that suffer from depressive disorders take medication. This medication consists of antidepressants. Individuals that deal with severe depression from their depressive disorders can participate in electroconvulsive therapy. This consists of a mild electric current that flows through your brain. Now we will specifically be discussing bipolar disorder. Bipolar disorder can be described as the syndrome in which abnormal states of mood, ranging from excesses of despondency, psychic slowness, diminished motivation, and impaired cognitive functioning on the one hand, and exhilaration, heightened energy, and increased cognitive and motor activity on the other, This disorder was first described in the medical literature in 1854.
There are two types of bipolar, bipolar 1 and bipolar 2. Bipolar 2 is the shorter one, and it is also more common.
As mania is characterized by impaired judgment, individuals can be at risk for engaging in high-risk, potentially dangerous behaviors that can have substantial personal, occupational, and financial consequences. The fullest description of bipolar disorder was made by the German psychiatrist Emil Kraepelin. He emphasized the periodicity of the illness. He proposed an underlying model of mood, thought, cognition, and activity, volition, to account for the classic forms of mania and depression called mixed states. This disorder commonly starts in young adults and is a leading cause of disability and premature mortality. Risk factors include stressful life events or experiences, certain neurological disorders, which in turn affect the brain and nervous system. These disorders can include traumatic brain injury, Parkinson's disease, long-term health conditions, and more.
Treatments for bipolar disorder. Over 15 approved treatments exist for the various phases of bipolar disorder. The outcomes can include side effects or lack of availability. There are three main classes of anti-manic treatments. They include lithium, mood-stabilizing anticonvulsants, and antipsychotic medications.
Lithium was the first approved treatment for bipolar disorder and continues to be the most effective drug overall. When you should think about seeing a doctor. After taking excessive amounts of drugs, alcohol, having feelings of extreme sadness, and thoughts of taking one's life. These are our sources.
Thanks for watching.